Hello everyone. You might notice a little change of setting, and that is because I am currently in New York, and it will be for a while because I have just been diagnosed with lymphoma. So I have cancer pretty much, but it's all good. It's gonna be fine. Basically what I have is called primary mediastinal large B-cell non-Hodgkin's lymphoma, and it is just a tumor that's growing right here in the mediastinum over my heart and kind of compressing on my lungs and my heart and stuff. So that's kind of how they found it. Actually, the story is that I came home for Thanksgiving to see my family because I hadn't come to New York in a while, and I went to see my doctor because I hadn't seen him in a while either. So I figured, why not get a checkup, get the all clear. So I went, and I did not get the all clear. We went, and he heard, like, he put the stethoscope on my heart and he heard a murmur, so he was like concerned. And it was Thanksgiving Day weekend, so there really weren't any cardiologists at the ER, so I had to wait, and he booked me a 9 a.m. appointment on the following Monday. So this is like over a month ago. So I go to the cardiologist on the Monday, and she does an ultrasound on my heart, like an echocardiogram, and she pretty much sees obstruction to my pulmonary artery. Like, I was sitting on that echo machine for 45 minutes because they were trying to figure out what was there, but like their machine was too weak, so they couldn't really see. It was just like black. Whereas on a stronger machine that they have in the hospital, it comes out, like you see the cells. So she was really concerned, and I remember I went there alone because my mom had to go to work, and it got bad when the doctor was like, "Can you tell your mom to come?" When I heard that, I was like, okay. So I called my mom, and she came in, and she told us, at that point she thought what I had was a thymoma. She thought it was just a benign growth of the thymus gland, and it would just be, laparoscopically removed with surgery, and that I would be fine. Because she checked my lymph nodes, she tried seeing if anything was enlarged. Nothing was enlarged. I felt fine. The only really issue was an increased heart rate because obviously my pulmonary artery was being restricted, so my heart was working extra hard, and still is working extra hard. Like, my heart rate is increased, but it's been going down ever since I started treatment, so that's good. So anyway, she tells us to go to the emergency room, and we go. It turns out that I had to be in the hospital for 2.5 weeks. I was kept there for a while, not knowing what I had. Like, they did a CT scan on me. They found like this baseball-sized tumor, pretty much. It's like 11.1 centimeters by 7.7 centimeters. And they thought at the ER at first that it was a thymoma as well. But from the second day on, once hematology saw my case, they were like, "No, what you probably have is lymphoma, so you probably have cancer, so you're probably gonna need to do chemo." And at first, no one was really telling me anything, so I was really confused. And we were all just in shock, really, because I came like home just to see everyone for a week, and it would turn out that I would be moving back for like 6 months. So yeah, I was in the hospital. Finally, my boyfriend flew over from Greece to come be with me in the hospital. And it turned out, like, in the end, that I did have a lymphoma because they did a biopsy of my tumor. I had to be put under anesthesia. They didn't know if they could put me under anesthesia because of how close to my heart this was, but they did. They did the biopsy. A lot of what they got was actually dead cells, so there was like a possibility that I would have to repeat the biopsy for a while. And honestly, I was so upset because I was sitting in a hospital bed for a week not knowing what I had, and I just didn't want to go like through another biopsy and waiting another week again. But thankfully they got enough to find it was the lymphoma. So the cancer I have is treated with 6 cycles of either R-CHOP chemo and then radiation, or dose-adjusted EPOCH-R. And no radiation because it's stronger. Like, for the dose-adjusted EPOCH, you have to be hospitalized for 5 days and get continuous infusion of chemo for that period of time, which is what they decided to do on me because I'm young and I am a girl, which means I am more prone to breast cancer and radiation to the chest. gives you a very, very increased risk for breast cancer, and we don't want that. Like, I don't want to be coming out of one cancer and like being prone to another one, you know? So no. Pretty much this cancer happens, it's weird because it's a subcategory of diffuse large B-cell lymphoma, which is the most common type of non-Hodgkin's lymphoma. However, that really happens to middle-aged to older males, and primary mediastinal happens to young females. So it was weird. Like, this is only 1% of all non-Hodgkin's lymphomas. I had no idea what lymphoma was. I had no idea that pretty much I could get this and not feel anything. Like, there are B symptoms is what they call it. There's symptoms that you could feel, like losing a lot of weight for no reason, night sweats that like drench you, night sweats, weird rashes and being itchy, or feeling really tired and short of breath. But I had none of these symptoms really. I didn't feel anything wrong. Like, I did have a cough, but when I did my PET scan, the cough showed out to be as an infection. So, like, you know, it showed up on the CT scan too, and then when they did the PET scan to verify my cancer, they also saw the opacity in my lungs, but it had decreased, so that means that I had an infection. So that's what the cough was. So I didn't really have anything that was pointing towards cancer, and you know, I felt great and I still feel fine, and I've already gone through 1 round of chemo. So yeah, currently I'm losing my hair. Like, this ponytail was just sad. See, hair. I will be shaving it off soon because I cannot stand just having hair everywhere. I'm getting tired of it, and I can already, like, if I lift this up I can see bald spots and I don't like it, so I'm just gonna shave it all. I've already bought a wig, so that's good. But yeah, it should be fine. Like, most people with this are cured, at least I've been told. So especially with the stronger chemo, you know, like, it's fairly recent that they found that this chemo works better, so to speak, and that, you know, it produces longer cure rates, so that's good. I am expecting to be done with treatment in April, and then 6 weeks later I will be doing a PET scan to verify that, you know, I'm cancer free, and then I will go on with my life. Currently I've taken off a semester from college because obviously I can't be in Ireland, and it's sad because I was supposed to graduate, but that's gonna have to wait. And yeah, if I guess you have this, or you had this, or someone you know has had this, I would really love to talk to you. I couldn't really find anyone, I guess, who had this. Like, a lot of people have come to my family and me to say that they had lymphoma, but it was Hodgkin's lymphoma because that's more common in people my age. But for what I have only seen like a bunch of people on YouTube or on Instagram and stuff. Not really anyone I have spoken to. So if you want to reach out, feel free. I feel pretty okay with my treatment. My fingers have gotten kind of numb, but they will be reducing my dose to stop that from happening. But I've been tolerating chemo well. My hair's falling, so it's obviously working. And my heart rate has started going down, which means the tumor is probably shrinking, so that is good. And that is all for my little update. If you want to see more videos about this and all this cancer journey stuff, let me know and I will post. And yeah, that is all.